you may not realize it, but our pets actually have a much higher rate of surgical complications than we do as humans. Not only are they pretty bad at listening to the doctor's orders, but we all know how much they like to lick. So let's get some helpful advice from Dr. Michelle Gonzalez, head vet at Rascal Animal Hospital. Good to see you, Dr. G.
Good to see you too.
All right, we have literally a perfect little pup in this girl today.
She is perfect. Her name is Tilly. She's about 5-6 months old, and she is literally perfect because she lives in a foster home with big dogs, and she does great with the big dogs, but she's been tested with all dogs, kids, cats, and she loves everybody. So she is perfect.
She's a lover. She's been licking you all day.
She has been giving all sorts of kisses. She just met me and she just wants to be in my lap, and she's just so playful. She is adorable. And she's available for adoption through our friends with Pet Promise.
Okay, she's got, what, a terrier mix?
Yeah, a little terrier mix. I think she may have a little bit of dachshund in there, but I mean, she is just adorable. And they're foster-based, so they're always looking for help with, like, you know, new foster homes and that kind of stuff. They have all sorts of great events that come up, so people should check out their website, petpromise.org, and get information about her if they want to adopt her, or about all the other pets that they have.
Okay, sounds good. And I am looking at Tilly right now, and she does have a little scar because she herself had a little surgery, right?
Yep, absolutely. She was spayed.
Okay, and we're going to talk about surgeries because I think as a vet, you know, obviously you see a number of surgeries, but there are some common things that probably most pet owners have to bring their animal in for, right?
Right, absolutely. I mean, the most common one that we always think of is spays and neuters. And one of the misconceptions is that people think, oh, it's a common surgery, so it's not a big deal. Well, it is a big deal, especially when spaying a dog or a cat. You're going inside of their abdomen. It's a full, big-time surgery. But the fact that they just go home the same day usually, and they're so much more resilient than we are, people think that it's not that big a deal. So when something happens or a complication arises, they're completely surprised about it.
Right, and you know, when it comes to an animal, I think the thing is, you know, even afterwards, they can't really tell you they're in pain. They can't really tell you something isn't feeling right. So as a pet owner, I mean, are there kind of some signs, some symptoms, things you should watch out for, especially after your pet's had surgery?
Absolutely. Like, one of the things that we tell people is if you're seriously concerned, bring your pet back, because everybody's idea of what is a serious complication can vary. You know, you can see a little bit of redness and feel like, oh my God, everything is horrible. Or it may be nothing. So if you're concerned, you should bring them in. But overall, how active your pet is. Clearly, we don't want them to be too active after surgery, but if they're really lethargic, not wanting to move around, that's a sign for concern. If they're not eating, not drinking, not wanting to go to the bathroom, those are all things that we need to, you know, keep an eye on. And then the licking. Because anytime something hurts them, it's just their natural behavior. They want to lick, they want to chew. We get a lot of people that say, oh, my pet normally doesn't lick, so it'll be okay. Well, they love to do that when nobody's watching. Like,
right.
When you go to work, when you're asleep, you know, we can't be watching them 24/7. So overall, really important to go over the post-operative care instructions with the veterinarian.
Okay.
Know what to expect before surgery, and then know what to expect after surgery, so that you have
an idea
of what you're getting into.
And there are some things considered normal after surgery too, you're saying, right?
Absolutely, because, you know, an incision is going to cause swelling. That, you know, any cut, it doesn't matter how clean or sterile it is, there's going to be swelling, there's going to be discomfort. So again, you have to have proper expectations. I say you're making an incision and they're laying on that belly. Well, they're going to get some bacteria into that. So there is a high risk for infection. Even if we're the best owners in the world, we put the cone on and we do everything right, there can still be problems. And the other thing is that we can control Mother Nature, and we can control biology, the way that we heal and the way that they heal. So, you know, again, it's having proper expectations so that then you're not disappointed with the results.
And you talk about the post-op instructions, which are obviously very important to follow. But are there things that these pet owners should be asking prior to surgery? Some common kind of questions they should be asking?
Absolutely. They should be asking exactly what the procedure is, so that they know what is going to happen. They should be asking about recovery time. What is the expected recovery time? If they need to make any special arrangements. There are surgeries like orthopedic surgeries, knee surgeries, that you may need to prepare your house for a 4 to 6 week recovery period. Those are things that you need to ask ahead of time. If it's a surgery with like the digestive tract, when can my pet eat food again, or what kind of foods they can eat? You want to have as many questions as possible answered prior to. And most veterinary hospitals, they will have that information. The technicians are well informed, so they can, they have people that can answer those questions for you.
All right, you got to be informed. That's the thing. Ask questions. Feel free. I mean, that's what you're there for, right?
Absolutely.
And again, if you want to adopt Tilly or a number of other animals, available at petpromise.org. You can do that. Website up on the screen for you. So thanks, Dr. G.
Thanks, Rowan.